Several treatments for treatment resistant depression. When we see what are the treatment options, more than 100 treatment options available. We can look reasons for depression. It is an actual disorder and it's explained two or more symptoms for that least 2 weeks. Then you have a depression. When we treat in depression, it's really important that you check for untreated underlying medical conditions. Many of these things, like low thyroid, anemia, diabetes, and other vitamin or hormone deficiencies, are easy to test and prevent. For example, someone used to experience bad depression, but when she got treated for low thyroid, he saw good improvements. Some common diseases that can contribute for depression. Another example, he got depression suddenly. She had no life changes, no trauma. She tried to get suicidal. Doctors tried all the treatments. No healing happened. Finally, she had a cardiac worm in her brain. When they removed it, after that he got healing. We are going to mention treating a substance abuse. Alcohol is a depressant. Standard treatments which include therapy, medication, and there are lifestyle changes which include learning new skills. You can learn exercise, diet, sleep, leaving toxic environments like abusive environments or super stressful work environments. There are few different treatment approaches when it comes to changing your diet and when it comes to improving your sleep. A lot of people feel like if we try to sleep better but I don't sleep good, you can improve your sleep. There are various types of therapy. If standard treatments are not work out, electroconvulsive therapy (ECT) is available. When we look, what is the electroconvulsive therapy? ECT is a procedure that uses a mild electrical current to cause a brief seizure. This treatment effectively treats severe mental health conditions, including depression, schizophrenia. ECT seems to change brain chemistry, and these changes can quickly improve symptoms of certain mental health conditions. More stigma attached to ECT is based on early treatments in which high doses of electricity were given without medicines to put people to sleep. This led to greater pain, more fear, and anxiety, fractured bones, and other serious side effects. Even though ECT still causes some side effects, ECT is much safe. Now we can see what is the transcranial magnetic stimulation (TMS). Transcranial magnetic stimulation (TMS) therapy is a non-invasive procedure that uses magnetic fields to stimulate nerve cells in the brain, primarily to treat major depression and other mental health disorders. TMS delivers electromagnetic pulses to specific areas of the brain, influencing neural activity. This is a beneficial treatment for those who have not responded to traditional treatments like antidepressant medications. TMS is useful for obsessive compulsive disorder and improving symptoms of depression. Increasing ketamine is recognized as a treatment for depression. This treatment is useful for those who have not responded to traditional antidepressants, not like standard antidepressants that basically target serotonin levels. Ketamine works a glutamatergic system, offering rapid relief depressive symptoms. Research has shown that ketamine can lead to significant decreases in depression scores, particularly in treatment resistant cases. Vagus nerve stimulation. Next, we can look vagus nerve stimulation (VNS) for depression. Involves a surgical procedure where a pacemaker like device is implanted in the body. The device is attached to a stimulating wire threaded along the vagus nerve. Electrical shocks stimulate the vagus nerve, changing brain wave patterns and reducing or eliminating depression symptoms. Treating epilepsy and depression. Psilocybin therapy shows Promise for treating depression. Psilocybin is a compound found in a certain mushrooms. It can improve symptoms of depression, particularly in treatment resistant cases. Next, we can see what is the stellate ganglion block. SGB, a procedure where local anesthetic is injected near the stellate ganglion in the neck, is being explored as a treatment option for depression, particularly when traditional methods haven't provided sufficient relief. SGB works by temporarily blocking the signals from the sympathetic nervous system, which can be overactive in individuals with depression and anxiety. This can help reset the autonomic nervous system and potentially alleviate symptoms of depression, anxiety, and even PTSD. Fecal microbiota transplantation (FMT) shows potential as an effective new treatment for major depressive disorder (MDD). FMT aims to restore a healthy gut microbiome, which is thought to impact mood and mental health. Study shows links between a gut microbiome abnormalities and depression. Now we can see about metabolic treatments. Growing scientific evidence suggests that a high fat, moderate protein, low carbohydrate, ketogenic diet can help those patients manage their metabolic health and improve psychiatric symptoms and the weight gaining side effects of their antipsychotic medications. Next, we can see cold water immersion involves submerging the body in water at temperature like 50 Celsius, 59 Fahrenheit, or lower this temperature. This practice can improve circulation, reduce muscle inflammation, and speed up recovery times. Mental health benefits include reduced stress and anxiety levels.